Elena Vasquez was not thinking about danger that night. She was thinking about her feet. She had been on shift for 9 hours. Her sneakers, once white, had turned the color of old paper. Her back was tight. She had eaten half a granola bar at 7 in the evening and had not touched food since. The emergency room at St. Raphael General Hospital was busy, as it always was on a Tuesday night, but not out of control. 3 patients needed her. The teenager in room 4 had an infection moving through her blood. The man in room 2 had a broken hand. The old man in room 6 had a heart that could not decide how fast it wanted to beat. Elena was managing all 3 at once, the way she always managed things. Quietly. Carefully. Without complaint. She was 34 years old. She had dark eyes that moved quickly and hands that had learned to stay steady even when the rest of her was afraid. Before she came to work in this hospital, she had spent 4 years in places where hospitals were not safe, where the sound of an ambulance was sometimes followed by more harm, not less. She had worked in South Sudan. She had worked in Kosovo. For a short and difficult time, she had worked in a field unit on the edge of a city that was falling apart. She had seen things that most people would not be able to describe without their voice breaking. She had come home from all of that and found a job in a clean, well-lit hospital in a city that felt ordinary. That was exactly what she wanted. Ordinary was enough. On a Sunday afternoon, 2 days before this night, she had been leaving her apartment building and had seen something happen across the street. 4 men. One of them was pushed against a parked vehicle. There was a short and terrible sound. Then 3 of the 4 men walked quickly away, and the 4th did not get up. Elena called the emergency line. She told the person on the other end what she had seen. She described the men. She gave the time and the exact location. Then she went inside her apartment and made herself a cup of tea and tried not to think about it, because thinking about it too much was not something she allowed herself to do. What she did not know was that the man who had been left on the ground was named Miguel Ortega. He was an accountant who had been helping the government build a case against a very powerful and very dangerous criminal organization. He had been talking to investigators for months. He had given them names, numbers, and records. He was the most important witness in a case that many people had worked very hard to build. And the men who ended his life had been watching. They had seen Elena. They had taken a photograph of her face. Within a few hours, they knew her name. Within a day, they knew where she worked and when her shift started and ended. She did not know any of this while she stood at her station on Tuesday night, sipping cold coffee and checking on Camila. Camila was the 17-year-old girl in room 4. She had come in through the emergency doors that afternoon with a fever that had already spread further than it should have. She was young and scared and she kept asking if she was going to be okay. Elena had sat with her between tasks, checking her temperature and adjusting her medication. At one point, Camila had reached out and taken Elena's hand and held it. Elena had held it back. She had told the girl she was going to be okay. 40 seconds later, the main entrance doors of the emergency room flew open. They did not come in all at once. That was the first thing that the security footage would later show. 5 of them entered through the front. 2 entered from the ambulance bay at the back of the building. They had spread themselves out. They were not shouting. They were not running. They moved the way people move when they have done something like this before and are not nervous about it. The guard at the front desk was taken down first. He was a quiet man named Jeffrey who had worked the night shift for 11 years. He did not have time to react. Within the first minute, the second guard had also been taken care of. The receptionist was told to stay down and not look up. In the waiting room, 14 people sat in frightened silence, none of them moving. One of the men, the one who appeared to be in charge, walked down the main corridor with calm, steady steps. He was later identified as Marco Delgado, known by the name Rojo, which meant red. He was 41 years old. He had been connected to 11 deaths across 3 countries. He moved through the emergency room the way someone moves through a place they have already mapped in their mind. He was looking for Elena Vasquez. Elena heard them before she saw them. She was in room 4 with Camila when something changed in the sounds coming from outside the door. It was not a loud thing. It was the opposite of loud. It was a specific kind of silence that arrived between sounds, a silence that she recognized. She had heard that silence before. In places far away from this hospital, in rooms much less safe than this one. She moved to the door and opened it 1 inch and looked out. She saw a man holding a weapon walking past the end of the corridor. She saw her colleague Marcus with his hands raised. She pulled the door shut without making a sound. She stood for a moment with her back against the door. Her mind was very clear. It was the kind of clarity that arrives when there is no time left for confusion. She understood that she was the reason they were here. She understood that the people in this building were in danger because of her presence. She understood that help would not arrive quickly enough unless someone bought more time. She looked at Camila, who was watching her with wide eyes. Elena pressed one finger to her lips. She turned off the audible alerts on the monitors. She disconnected the sounds from the 4 station. She moved a supply cart quietly against the door. Then she crouched beside the bed and took out her phone, held it under the blanket at the edge of the mattress, and typed a message to her colleague Damien, who was stationed in the trauma bay on the other side of the building. The message said, "There are armed men inside. At least 7. They are looking for me. Do not try to stop them. Keep everyone safe. Call for help without making noise. And leave the crash cart in Bay 2, parked at an angle, with the door open." She sent it. Then she put the phone away. Then she began to think very carefully about every object in room 4. She knew this room the way she knew her own hands. She had spent hundreds of hours in rooms exactly like it. She moved silently along the wall, and what she collected, she placed in a specific order near the door. She worked without hurrying and without shaking. Camila watched her and did not make a sound. Outside, Rojo's team was clearing the floor room by room. They had already checked 5. They had found her station. They had found her coffee cup, still warm. They knew she was close. 3 of the men were moving toward the patient corridor. 2 were positioned at exits. Rojo and 1 other were working their way toward room 4, and they had taken Dr. Raymond Cho, the attending physician, and were using him to move through the hallway without resistance. They were 30 seconds away. Elena made a decision that would later be discussed at length by people who study these kinds of situations. She did not wait to be found. She unlocked the door, stepped out into the hallway, and stood with both hands raised above her head. She said, in a clear and level voice, "I am Elena Vasquez. I am the person you are looking for. I will go with you. But first, let the doctor go." Rojo looked at her for 2 full seconds. Then he released Dr. Cho, who stumbled back and was quietly guided away by a nurse who had the presence of mind to pull him into a side room. Elena was now walking ahead of Rojo toward the ambulance bay. She was not running. She was not resisting. She was also not planning to leave. As she turned a corner, she saw the crash cart. Damien had followed her instruction. It was exactly where she had asked. She glanced at the defibrillator. It was charged. She noted the angle of the cart, the distance to the exit, the position of the men walking behind her, and the men covering the corridor to the left. She had 1 item in her right pocket. A syringe, preloaded with a fast-acting sedative that she had placed there before leaving room 4. She stopped walking. She turned around. What happened next took 8 minutes. It was later reconstructed from security footage, written statements from survivors, and Elena's own account given to investigators. The 4 stand she had quietly moved from room 4, and which Damien had placed behind the crash cart as her second instruction, was the first thing she used. She grabbed it and swung it hard at the man standing nearest to her. The impact was sudden and effective. He went down without a sound. Rojo moved fast. He raised his weapon and fired. The shot hit a wall panel to her left. She had already dropped to the floor and rolled behind the crash cart. She came up with the defibrillator paddle in her hand. She had set it to its emergency discharge level. When the second man came around the side of the cart, she pressed the paddle to his chest. He fell. A third man fired from across the room. The shot was not accurate. It caught the edge of her left arm, a surface wound that burned sharply and began to bleed. She did not stop. She moved into the supply corridor, which was narrow and gave her better cover. The fourth man came from behind and grabbed her. She reached into her pocket, removed the syringe, and pressed it into the side of his neck. He went limp within 12 seconds. She caught him so he would not fall loudly. She took his weapon. She had not held one in 2 years, but her hands remembered. The fifth man came around the corner of the corridor. She fired once, aiming carefully, and hit his lower leg. He went down loudly, which was something she had calculated. The sound pulled the sixth and seventh men away from the waiting room, away from the patients, and toward the corridor where she was. She moved before they arrived. By the time she reached the trauma bay, she had positioned herself near the wall beside the oxygen release valve, which she had opened silently as she passed. The floor between her and the entrance was coated with alcohol from a container she had emptied on her way through. The crash cart was behind her. Rojo entered the trauma bay. He was fast and he was trained, and he had her against the wall with a weapon at her chin before she could get away. He was breathing hard. His eyes were sharp. He told her it was finished. She told him she agreed. Then she ignited the lighter she had taken from the supply cabinet in room 4 and dropped it onto the alcohol-covered floor. The flash of fire lasted less than 2 seconds. It was not meant to cause serious harm. It was meant to blind, to disorient, to create a moment. It did all three. Rojo stepped back, shielding his eyes. She shoved the crash cart with both hands, driving it into him. He hit the wall. She put him down with the force stand that had followed her through the corridor. He was unconscious when the doors burst open 11 seconds later. Federal agents entered from 3 points simultaneously. They had been scrambled the moment Damien's silent call had been received. They moved through the building quickly, securing each area. What they found was not what they expected. 7 men. All 7 were down. None of the hospital staff or patients had been harmed. The waiting room was shaken but uninjured. Camila in room 4 was still lying exactly where Elena had left her, still quiet, following the instruction she had been given. Elena was sitting on the floor of the trauma bay when the agents found her. She had a wound on her left arm that she was pressing a folded piece of gauze against. She was not crying. She was breathing slowly and deliberately, the way someone breathes when they are choosing to keep control. One of the agents asked her if she was all right. She said she needed to check on her patients first. They let her. She walked down the corridor, checking each room. She stopped last at room 4. She pushed open the door. Camila was awake and watching the entrance with enormous eyes. Elena sat down on the edge of the bed. She was still holding the gauze to her arm. She did not say anything for a moment. Then Camila reached out and took her hand, the same way she had done earlier in the shift. Elena held it back. Then she let herself shake, just for a few minutes, quietly, while no one except Camila could see. All 7 men were taken into custody that night. Marco Delgado, known as Rojo, was the most significant arrest. He was connected, through subsequent investigation, to a criminal organization that had been operating across borders for more than a decade. His capture opened doors that investigators had been trying to open for years. Over the following months, 34 additional people were arrested, including several individuals who held positions of public trust in 2 different cities. Elena's testimony was central to the case. The description she had given on the phone 2 days earlier, combined with security footage that had captured her image without her knowledge, gave prosecutors the connection they had been missing. The organization had tried to remove the one person who could close the gap in their evidence. Instead, they had walked her directly into a situation that made her impossible to ignore. The lead investigator on the case, a man with 17 years of experience in situations like this one, reviewed the security footage from the hospital twice before saying anything. What he said was, she never lost her calm. Not once in 8 minutes. She made decisions the way someone makes decisions when they have planned every step, except she had about 90 seconds to plan. He had worked with trained professionals his entire career. He said he had never seen anything quite like it. Elena gave one interview to a local newspaper in the weeks that followed. She was not comfortable with the attention. She answered the questions briefly and with care. When the reporter asked her what she had been thinking during those 8 minutes, she said she had not been thinking. She said thinking was too slow. She said she had been moving from one decision to the next, and that the training she had received in other places, in harder circumstances, had simply come back to her when she needed it. When the reporter asked if she felt like a hero, she said no. She said she felt like a nurse who had a very hard night at work. She turned down every other interview request. She did not appear on television. She did not sell her story. 11 days after the night in question, she returned to St. Raphael General Hospital for her regular shift. Her manager had offered her more time away. She declined. Her first patient that day was a 7-year-old boy named Oscar who had fallen out of a tree and broken his wrist. He was frightened about the process of having it set, which he had been told might hurt. Elena sat beside him while the doctor prepared. She held his hand. She told him it was going to be okay, and that it would be over quickly, and that he was being very brave. He believed her. Camila was discharged from the hospital 8 days after the night of the incident. Her infection had been caught in time. Her treatment had worked. On the morning she left, she asked one of the nurses if she could say goodbye to Elena before she went. Elena came to her room. Camila stood up from the wheelchair she had been placed in for the exit and gave her a long, tight hug. She did not say anything. Neither did Elena. Some things do not need to be said. Elena Vasquez had not come home from the difficult places of the world looking for another fight. She had come home looking for ordinary life, for long shifts and cold coffee and patients who needed someone steady to hold their hand. She had not wanted to be a person who stood in a dark hallway and made fast decisions in the middle of fear. But she had been shaped by what she had seen and done and survived, and when the moment arrived, that shape held. She did not consider herself exceptional. She considered herself prepared. There is a difference, she would later say, between bravery and readiness. Bravery, she said, is when you are afraid and you do it anyway. Readiness is when you have been afraid so many times before, in so many difficult rooms, that fear becomes just another part of the room. You notice it the way you notice the furniture. And then you move around it and get to work. She went back to work. She kept going back. Every shift, every patient, every cold cup of coffee left half finished at the station. That is who Elena Vasquez was. That is who she remained. End.